All right, good afternoon, everybody. Thank you for coming to our COVID-19 local response press briefing. Today speaking, we have Lisa Clute with 1st District Health Unit, Randy Schwan with Trinity Health, Bob Rood, the Sheriff of Ward County, Sean Sitma, Mayor of City of Minot, and myself with Emergency Management. First up, we have Lisa.
Good afternoon, everyone. Well, we've had a busy week this past week, and I'm going to start with reporting our confirmed cases within the district. So, to date, Botno has tested 285 individuals. 2 have been positive. Burke County has tested 131 individuals. 5 have tested positive. McHenry County has had 311 individuals tested. 2 have been positive. McLean County has had 641 tests conducted, and there are 7 individuals identified with COVID. Renville County has had 148 tests conducted. 1 person was positive. Sheraton has had 42 tests conducted, 0 positives, and Ward County has had 4,228 tests to date, and we have 36 positive cases. So for the district, we have 53 positive cases. 34 of those cases have recovered. 19 are currently active cases. Most of the tests done this past week were targeted testing within Ward County. 164 of those tests were done in the rural counties. 9 new cases were identified in the past week, 1 in Botno, community transmission, 8 in Ward County, 5 were identified through targeted testing, 3 from testing of symptomatic individuals. So today truly is a good news day, and some things that led up to that good news. So as you watched last week, you saw a significant spike in our cases within Ward County. We were concerned about it, but not necessarily surprised because we had done a lot of testing that past week. However, late Friday, I received a call, and they were asking that some individuals be retested. The lab had identified 2 machines within the state lab that were environmentally compromised. The governor is going to address those events this afternoon at 3:30 on his conference call, or on his press briefing. So once that was identified, they changed those tests to inconclusive and asked that we retest those 19 individuals. Now, there were some tests that were conducted from our district that were not tested on those 2 machines. So those continued to stay positive, and there was no concern regarding those tests. So consequently, by Saturday, I think it was about 1 o'clock, we had everybody retested. We had contacted everybody, retested, and our tests were sent down to the state lab for retesting. Trinity did several tests, and we did the rest of the testing at 1st District. So between the 2 entities, we had a quick response. We very much so appreciate all individuals responding quickly and coming into facilities to be retested. Once we received those results, late yesterday, well, mid-afternoon, it was around 3:30, and all of those results came back as negative. with the exception of one, and that test is still pending. So all of those individuals were contacted, released from our surveillance, as well as all of the individuals that we had identified as close contacts when we were notified of positive cases. So we had identified 157 close contacts of those 19 presumed positive cases. Those people were being contacted late yesterday afternoon and into the evening, and also released from self-isolation and self-monitoring. So the good news is the concern of a significant increase in cases has been identified as not the case. The bad news is we feel very unfortunate, or we feel bad that people were identified as positive cases and there was a lab malfunction. So I know that the governor will address this and probably explain this in great detail, but that is what the situation was throughout the weekend. We have several testing events coming up in the next week. We have at First District put in a significant amount of requests. So far, the state has pledged 2,240 tests for events in the next 7 to 10 days in Ward, Burke, and Renville County, as well as they are arranging a testing event in Botno that was previously scheduled for this week, and it has been reassigned to, I believe, the following week, or I'm not sure. It has not been scheduled. So I can also report that in McCluskey, Northland Community Health Center will be conducting 150 tests within Sheraton County. Our local public health nurse will be there to assist them with that. And all I can say is stay tuned. We do anticipate that we will have 2 days of drive-through testing occurring next week. We anticipate that we will have 1,000 doses available for that drive-through testing. And we have that tentatively scheduled for next Tuesday and Wednesday. However, stay tuned for any of those details, and as we continue to gain confirmation of how that event will occur. So details will be released as soon as they are available to us. The governor gave guidance on last Friday to allow businesses to strongly recommend that businesses, employers, and public entities continue to follow the recommended guidance. He has changed that language to must, from must to strongly recommend. First District echoes that guidance, and we ask that everybody continue to follow those recommendations too. We are getting a great deal of questions from entities that we license. The Food and Lodging Establishment, the Environmental Health Division, is pulling together some relevant information to make it easier to find, and we'll be sending an email out to our licensed entities. So again, it falls back to the individuals. Continue to protect yourself. We strongly recommend that you social distance, practice good hygiene, wear masks out in public, assume that COVID-19 is in the public, and it's your responsibility to protect yourself from that. So I will be available later for questions, and I will turn it back to Jen. Thank you.
Thank you, Lisa. Up next, we have Randy Schwann with Trinity Health.
Good afternoon. Just a couple of comments from Trinity Health. One that we were pleased to learn last 24 hours that of the 10 retests that we were asked to do, the 10 positive retests that we were asked to perform from the Department of Health have resulted in 9 negatives. We're still awaiting 1 to be returned. So the other 4 of our 14 that were positive remain positive. To our knowledge, there were 4 positive tests out of our group. So those folks are still on quarantine and following the guidance that to self-isolate, and their return to work will be driven by the guidelines by the State Health Department, CDC. So that was good news. I just wanted to put a big shout out to those folks who, within a short time, again, were able to pull together a lot of people and facilitate retesting and submitting those for consideration to the state lab. These testing events that are conducted either at Trinity Health with our own employees or in the community, it takes a lot of work to get that done, and I'm sure you all appreciate that. And we're all interested in keeping our community safe and keeping our staff protected, and that's why we do these things. So to those who do that on a daily basis and are on the front lines, a great deal of appreciation goes out to the amount of work and coordination that they put into making that event smooth. Now, as Lisa reported, in the next week or so, maybe 7 to 10 days, Trinity Health will be conducting our second phase of sentinel testing at our facilities. So we anticipate the collection of hundreds more tests, depending on the supplies we get from the Department of Health, will facilitate testing for another group of our employees. So as far as the number and the days, we'll have to wait and see how many tests are available and when they are available. But we're proceeding with our plans to coordinate that sometime next week. I guess the last point to be made around Lisa's reminder about self-distancing or social distancing and protecting yourself is how to protect others. And so I think we all have to kind of get in the habit when we leave the house in the morning or afternoon to take a mask with us. Because there are places where you will not be able to go without a mask. And whether you agree with wearing a mask or not, I think the governor had a great message about that. We should be prepared to wear that mask because you may need to frequent one of those facilities, including healthcare. So the number of facilities that you will be required to wear a mask to frequent are increasing. So it's just a good habit to have in your vehicle or on your person a mask that you can wear. And I ask you to bring that to any of our Trinity Health facilities when you arrive. Thank you.
Thank you, Randy. Up next, we have Sheriff Rude with Ward County.
Didn't know I was going to speak. I thought I was just here to answer questions, but I guess all I can do is echo what has already been said. I was actually somewhat surprised and pleased to find out that 7 of the people that tested positive for the Sheriff's Department were retested and they all came back negative. Unfortunately, that does leave 2 that are still in that positive category. They're being quarantined and they remain quarantined until they're tested and then come back. We're pretty much back up to where we can be as far as staffing goes, with being able to bring not only the people who tested positive, but the close contacts. And we actually took a lot of our staff out last week, but we're pretty much back to normal now because of that. So we're following the guidelines, all the CDC guidelines, and we're working with the 1st District Health Unit to do the best we can to keep everybody safe. We are going to be participating in the targeted testing. Hopefully, at the end of the week, it's scheduled at the end of the week, so hopefully the tests are here. We're going to be testing everybody from the sheriff's department, our detention center, our juvenile detention center, the small town police departments in the area are also going to be included with Ward County on that, and we're going to be testing every inmate in the facility just to make sure that I guess we're trying to cover all of our bases and keep everybody safe as much as possible. We're also going to be testing the election workers for Ward County because we're getting real close to the election, and I think we got to make sure that they're safe. There's people dependent on that. So I think that's about all I got for now. I can answer questions later. But.
Thank you, Sheriff Rude. And up next, we have Mayor Sitma.
Good afternoon. Again, I want to say thank you to each and every person that has continued to cover this, as well as our health professionals and law enforcement, First District Health Unit, and Trinity that has continued to make themselves accessible throughout the COVID-19 for continuous flow of information through all of this. I think that that's been critical, especially to not only the city of Minot, but throughout the region as we've watched all of this evolve from March 11th forward. Certainly, we did have some good news, if it can be construed as good news, with that correction from the state lab identifying that problem with that testing equipment, but that also did give us pause of the reality of the situation as what it could be or what it can be if we don't continue to take this very serious. With that being said, I've said it many times before, I'm exceptionally proud of the community and across the region, seeing more and more people that are taking heed to the advice of the medical experts and wearing masks when you're out in public. And certainly any of those folks in understanding that it may not be you per se that is the one at risk, but protecting someone else that might be a high-risk individual for COVID-19. Certainly for a large populous area in North Dakota, we do have some of the lowest numbers in the state. With that correction, and we certainly would like to keep those numbers as low as we can. But with those numbers and corrections, that does give us confidence to move forward with the North Dakota Smart Slow Restart. We had anticipated looking at a June 1st reopening of City Hall. I think with the numbers that came out last week, even with one of our Minot police officers that did test positive and that is asymptomatic, that did give us a little bit of pause as to question then what is the community spread that we may not be aware about in our community, which is why we took that delay one more week to June 8th so we can get that target testing through and really get a holistic idea for our community on what that looks like. My anticipation is June 15th will be the day that we are aiming for right now. Of course, situation will highly depend on what the target testing reveals, but June 15th being the day that we are looking at the slow restart for the city facilities being reopened in many different capacities. Of course, the Minot Police Department, Fire Department will continue to have a very limited, if closed, access to the public so that we can continue with the continuation of operations from our first responders, law enforcement officers that are there to keep the community safe. I do anticipate if numbers continue as they are right now and the target testing comes back, I think in our favor we would look at as June 15th possibly for our first city council meeting with the new format with, of course, social separation here, and we will have some availability out in the lobby as well for people to view if they do want to come. I do want to also emphasize for folks that might be watching at home, we do have that portal so people can log online to minotnd.org and submit any kind of suggestions, recommendations, or comments for that June 1st City Council meeting. We've heard about this, that we're all in this together, and we know that we're only going to get through this together, which is why we continue to emphasize that it is so critically important to listen to the people that and the experts that are the experts that have done the research on how viruses and how community spread works, and that why we need to take their advice to heart. And that is how we're going to get through this. We've gotten through many disasters as a community, whether it be the '69 flood, the flood in the '70s, the train derailment in the early 2000s, or the 2011 flood. We got through it together. We'll get through this together, I have no doubt. That being said, I also want to take a moment to look forward and to also take that little bit of caution looking forward. As some of the experts, not only nationally but around the state, have advised that we may have a reprieve through the summer as we work through this. If our complacency sets in, it is likely that we would see an uptick in the fall. Mark Vollmer talked about that with Minot Public Schools and already anticipating that type of resurgence in the fall, as we see so often with flu and other just illnesses that go through the community as the weather cools down. And certainly we are preparing for that. I think people themselves should also keep that in mind working forward so that we ourselves are prepared for whatever comes down the pipeline. However, I think it is important that we continue to be smart, to get out and support our local businesses as we can. As I put out in the Minot Daily News here over the last couple of weeks, there are businesses that are going to have a changed format, and I think it is responsible for us to accept that they may do their curbside and takeout delivery as their best option for their business. And I think we need to be especially receptive to the difference in each different business. A small business may only have one or two people, and they need to conduct themselves the best they can to ensure the viability of their operations. So I just ask that each one of us not only have respect for our families, for our neighbors, but also for our strangers in our community, those people that are out there doing the best that they can when the circumstances that are surrounding them, and understand that again, the spread may not be deadly to an individual that is strong and healthy, but the connection from them to somebody who might be at risk is really the key importance of this. As we look forward to that June 15th opening date, I would expect a difference of opening when we have the Minot Public Library. I think Janet and her crew are already working towards getting all of that information out to the public. I would expect City Hall to be opened up as long as numbers continue as they are in an open but different format as well. And again, I just really ask the community to take this to heart and do not let complacency set in. I don't want to see what we saw at the end of last week become the reality and community spread to run rampant as we've seen in another part of the state or other parts of the country. So thank you everyone so much for all of their due diligence and their sacrifice to this point, because there have been many people that have sacrificed a tremendous amount, and I would hate to see it in vain. I certainly will stand for questions here as soon as we're wrapped up. I'll turn it back to Jen. Thank you.
Thank you, Mayor Sitma. Up last, I have a little bit of good news on behalf of Visit Minot and the Minot Chamber of Commerce. We have a new hometown hero that we have nominated and accepted, and it is Darcy Beartness with the North Dakota Face Masks Warrior. She has been leading the charge in North Dakota to sew face masks for medical facilities and first responders. And to date, she has organized over 500 folks that have sewn 21,000 masks statewide. So congratulations to Darcy. It's been a pleasure to work with you in our office, and we appreciate all the work you and your fellow sewists have done. With that, we will stand for questioning. Who wants to go first? Oh.
This question's for Randy.
Right.
I know you said that masks are required at the Trinity Hospital, but they're not required at the clinics. We had a viewer call in saying that his wife goes to the cancer center and people are not wearing masks there. Why are they not required at facilities like that or all of the clinics?
They are required at many of our locations. We're contemplating a policy that will clarify that this week that will be more comprehensive in masking at all facilities, but we're not prepared to do that yet. Part of the difficulty in that is we have limited masks to give out. And so we're wrestling with the idea of trying to balance benefit to risk, right? So if you come to an appointment and you don't have a mask or you can't wear one for whatever medical reason, we can't just push you out the door and tell you can't come back. So we're trying to strike that balance between those who should and those who can't wear masks, first of all. Secondly, trying to get a supply adequate that we can give those who need them a mask to wear. And lastly, just recognizing that when you come to a medical appointment, it's different than coming to an emergency room. Emergency room, you wouldn't have chance probably to get a mask first. So it wouldn't be expected that you'd bring one to that emergency room visit. But it is expected that you'd bring one to any other medical visit. And whether you wear it or not, there are some who agree with it, some who disagree with it. To this point, we've been strongly urging, strongly encouraging, strongly trying to influence. But the fact is we have about 30% or less who do not bring a mask or do not want to wear one. And so we've gained, I think, critical mass in the public who know and expect that they will be wearing a mask when they come to a medical appointment. And so our ability to move forward with a mandatory masking policy is further advanced today than it has been. So I look forward to that changing. As to whether or not I've heard of anecdotal information about, hey, I was here and I didn't see a mask, and I was over there and somebody touched their face, and those kinds of anecdotal stories exist, and I can't refute them, nor can I substantiate them. So if you're sitting in any place, whether it's a clinic or a restaurant or whatever, and you see other people who are not wearing a mask, your ability to influence them is probably not very great. The best way to do it is by wearing one yourself. And by becoming more normalized, that objection will start to wane. And I think that's where we have to get to as a community. So the fact is that the Cancer Center, it is mandatory masking, and whether or not everybody's wearing one, I can't answer that question today. Whether somebody was going without one last Tuesday, probably, I don't know. But I can tell you that our stance has always been that wearing a mask protects others. And when you're in a medical facility, we expect that you're going to wear one so you protect our other patients and staff, as we are wearing one, because that is mandatory. That I wear my mask every day when I'm walking into the building, and I'll wear it until I leave the building, except in those areas of my office and other areas that are not common or social distancing as possible. So we do it for you, you'll do it for us. I think that's kind of be our stance. Jean?
Since you're up there. So you have 4 employees who are still considered positive because their tests were not part of the malfunction.
Right.
Those people are asymptomatic, and you and I had a conversation a little while ago about asymptomatic cases and whether or not they develop symptoms. If they were to not develop symptoms, and how are they ruled out, or not ruled out, but considered recovered? And the CDC, I've learned that if an asymptomatic person tests positive but never develops symptoms, it's my understanding that CDC guidelines are that that person is released from self-isolation 10 days from the date of their test. Yet we don't know how the disease can be carried and spread asymptomatically. So does that give you concern that they're just released after 10 days and they don't have to test negative in order to come back to work?
So the question was around the...
We have the mic, so they can hear.
Pardon me?
The mic, we have
Oh,
the mic. So
you heard the question? Everybody heard the question?
I think so.
So it was 14 days, I think, initially, and has been adjusted to 10, if I recall, on your self-isolation requirements, guidelines from CDC, once you've been positive but asymptomatic. Does it concern me that within 10 to 14 days you'll return to work? Every organization probably has a little different take on that, but they're following pretty much those guidelines. To me, we're in an environment where you're masking and wearing PPE anyway. And so after a 14-day stint, 10-day stint of being removed from the workplace, I don't have a lot of concern about that, no. I don't know. We'll have to leave it to the medical experts to determine. The CDC presumably has, yeah, okay, we'll have Dr. Souther maybe address that. CDC has guidelines that are based on medical science, and I can't answer that, so.
So tag on to what Randy says. He just said that exactly the way it is. They're using science to do that. If you look back at the guidelines they've had, they've actually narrowed that. So they're using some science behind that. When we look at virus shed after disease, we actually have personal experience with some people that have tested positive, that you might actually, because that test is so sensitive, even a small fraction of the virus that's not active can actually trip the test positive. Doing a follow-up test, that person might test positive for weeks afterwards. That does not mean that they're infectious. And through studies, the CDC has come up with guidelines around that. So I think we have to follow the guidelines. I'm not a scientist that delves in that, but I've read some of the things that they've done. If we did a testing strategy, some of these people would be home isolating for half of the summer and could still be testing positive. And they would not be infectious because what they're shedding are fragments of an inactive virus that's not going to cause somebody else to be ill. So I think our best thing is to look at CDC guidelines. That's exactly, if you look at the state guidelines, they follow the CDC guidelines, and Trinity Health policy follows those guidelines exactly. So there's two strategies that you can use, and that's the testing strategy or the time strategy. Now, that 10 days, if you remain asymptomatic for the whole 10 days, from the time of your test, you're considered to be non-infectious, and that's what the CDC recommends. If you become symptomatic, then that changes that a little bit, and you have to be asymptomatic for at least 72 hours before you can go back. So if I tested positive and I was asymptomatic, and now I developed a cough, a little bit of a fever 3 or 4 days into it, I have to wait until my symptoms are gone. So that could affect that time frame and actually make that longer. But the recommendations, if you remain asymptomatic, is 10 days, and that's based on science through the CDC.
But for that asymptomatic person who never developed symptoms, could they not just be shedding virus too, and we don't know if they're actually contagious? I mean, I'm concerned about the fact that the disease course can run very long in some people. In asymptomatics, have there been any studies to let us know how long an asymptomatic person really is contagious?
I can't quote you specific studies, but I think if you look through the CDC, they're not just picking numbers out of the air for that. They're actually basing that on science. And we also know that, so if I come in contact with the virus today, it takes about 5 days before I become active in the disease and producing virus and shedding it. And this virus affects various people differently. So some people have very minimal symptoms or are asymptomatic, at least not to the point that they're recognizing the symptoms. Others get very ill, and a lot of that's based on underlying disease. But when you look at the time course for the active shed of virus, I think they're fairly confident in the time frame that 10 days is appropriate. Otherwise, they wouldn't have shortened that up from the 14 days that they initially put out for asymptomatic people. Like I said, they're not picking those numbers out of the air, and I can't quote you the exact studies, but I think if you really dig into what they're doing, they're actually looking at science to make those recommendations.
A question for the sheriff. My question is, you're testing inmates. If you find some who are positive, do you have a plan for how you would handle that? Are you doing some things differently now already?
As you know, we built a new section to the jail. The old section is still really not being used right now. It's undergoing updates and things like that. But we do have 4 cell blocks in the old jail that have been set aside, sanitized, and ready to go. So if something like that were to come up, we do have the ability to isolate those particular inmates in their own cell or in their own cell block.
How do you handle them staff-wise? Are your staff just going to suit up, or do you totally isolate them? They may be sick.
They wouldn't be totally isolated. We do have, nurse practitioners that come in 5 days a week for a sick call, and that helps us keep up with some of that. The staff right now they've been wearing PPE since it started. They're required to wear masks and things like that, and gloves. Anybody who's symptomatic or even questionable, We have tested some inmates over the course of this, and they've all come back negative so far, but if they're showing any kind of symptoms at all, I mean, the jail does have, we have gowns, we have shields, we have masks, we have gloves, and they're separated right now. And the staff, anytime the staff deals with that in particular person, you know, has to be wearing the appropriate PPE.
A question about the false positives, maybe for Lisa. Could you give a breakdown of where those false positives are coming from as far as Trinity employees, sheriff department?
The question is a breakdown of where those false positives were. I believe that 10 of them were at Trinity. 9 of them were through law enforcement and emergency responders. I believe that's correct. 9 were through law enforcement, emergency responders that First District had tested, and then we retested those. We had 19 within the district that we had to retest. So
There's still 2 positive at the sheriff's department though, correct? So that's only 6.
that there are still 2 positives, but that was not in the 19 that were retested. The 2 positives,
Jen is saying that they are though.
no,
Agreed.
no.
The 2 positives were not retested.
Of the positive cases that were identified last week, 19 of those positive cases were run on the 2 machines at the state that were compromised. The other positives stand as positive. They were not compromised, so they did not need to be retested. So yes, Ward County still does have 2 positive cases. They did not need to be retested.
How many were retested at Ward County?
7.
7. That still leaves 2. 10 were retested at Trinity and were negative. 7 were retested at Ward County and were negative.
And we had, at the police department, we had a retest, and so we had,
One is positive and was not retested, correct?
I know.
That still leaves 2.
okay,
One that we're still pending results.
one is a pending result. I'll double check, Jean.
And then there's another one, that leaves 2. There were 2 positives that I dug up from Sanford.
Hmm.
And I haven't been able to get a hold of, but doesn't that leave 2, or am I doing my math wrong here?
I'm not going to speak to what individual facilities were retested. You've identified the jail, and they have been open about that. And so we did some testing, and 9 individuals were retested. 1 is still pending.
19.
19 were tested. First District retested 9 individuals.
How are you handling false positives in the future?
We will continue to handle positive cases as we have always handled positive cases. Again, it's important for the community to understand this was not a concern regarding the testing viability. The testing that we do is still very viable, very correct, as Dr. Sather said, actually very sensitive. It was a lab process, a compromise. So we will continue as we have. We respond quickly when we get positive cases, as we did last week when we received those positive cases. Within, I believe, 24 hours, 157 people had been identified and isolated. So.
Question on the drive-up events.
Mm-hmm.
You mentioned that there was going to be a drive-up event, a literal drive-up event here in Minot.
Mm-hmm.
Is that like one of those Sentinel events where you're going to be inviting the public to come?
That's correct.
Could you talk a little bit more about that? How many tests and who could come?
That is the 1,000 tests that we have identified, 500 for one day, 500 for the other. More details will become available. Those numbers were just verified with me last night. Now, as always, this is an ever-changing situation. If something changes throughout the weekend or the rest of this week, those numbers could change, but we are moving forward with that, and we will be planning that event and making announcements for the public as soon as we have that information available.
Are you able to tell us at all about whether or not it's narrowed down to certain members of the public, or will it just kind of be open to everybody?
We will, okay. They are not hearing the questions on Facebook. So, yes, the question is, will that be targeted testing as well as public testing? We will encourage essential workers throughout the area, as well as I would anticipate that we will make that available for the public too. It will all, as I said, depend on how the situation evolves throughout the week. That is our initial plans. And I did want to add on, we are testing a significant number of first responders this week, Friday, as a follow-up. So with the sheriff, the city, ambulance, I believe there's approximately 450 tests ordered up for the end of this week that we will be conducting. Anything further? Thank you.
All right, one last pass for questions. Yes.
Just to be clear, 10 of the 14 in Trinity turned out to be negative, and 7 of the 9 sheriffs in jail turned out to be negative. Is that correct?
That's correct. 10 of the tests that Trinity performed, correct me if I'm wrong, were negative, and 7 of the retests that happened for, stand by. We're still waiting for 1 out of the 10 from Trinity. But so far, 9 are negative, correct? And then for Ward County, yes, all 7 retests that we had were all negative.
Doesn't that leave 2?
Yes, that leaves the two tests that were positive in the jail, but they were not retested. They weren't asked to retest because their test didn't go through those 2 machines that were compromised.
I guess this is a general question for any healthcare providers that would like to speak on this. Will they be working with Ward County officials or, essential workers and fire department, police officers to kind of help practice those guidelines to avoid spreading COVID?
So the question is, are there going to be healthcare workers or perhaps even First District there to help first responders practice the CDC guidelines?
Yeah, or help with the contamination and prevent spreading.
I'll let Lisa answer this.
Our environmental health staff do work with those agencies. Last week, when Ward County was identified as having some cases, I think it was within a couple hours, we were working with their Human Resources Division and the jail, and the sheriff can comment on that, giving guidelines, cleaning advice, recommendations on possible personnel policies and so forth that they might consider. So yes.
All right, one last pass for any further questions. Yes.
Are there any plans to do targeted testing for just inmates?
The question is there any plans to do targeted testing just for inmates? The sheriff can speak to this.
Yeah, the inmates will be part of that Friday test, so any inmate in jail currently on Friday will be tested at that time.
All right. Anything further? All right. Thank you all for coming.